I'm Dr. Paul Sederna, and I'm a plastic surgeon. I came to the University of Michigan many years ago to pursue training in biomedical engineering. I'd had an interest in mathematics. I'd had an interest in solving problems. Once I began my career in medicine, it was a great opportunity for me to apply some of the things I had learned in biomedical engineering to novel and challenging situations I was faced with in medicine. So I pursued career training in general surgery, and that provided me with a great foundation as a surgeon to later develop my interest in plastic surgery, a field that really supported my interest in innovation, my interest in discovery, my interest in finding new and novel situations and approaches to solve some of the most challenging reconstructive issues. The Neuromuscular Lab at the University of Michigan is a lab studying ways to optimize functional recovery following devastating injuries of the extremities. We've worked a lot on nerve regeneration and understanding how nerves regrow and how they reestablish connections to provide the best functional recovery following injuries. Along the way, we became focused on functional restoration following limb loss, trying to develop better ways to give somebody a limb that could work like their normal limb, a limb that could move like their normal limb, a limb that would give them the ability to have sensory feedback so they could feel the touch of their child's hand. And it was that spirit and that approach that drove the research interest here in my lab to find a better solution for people with limb loss.
The primary goal of the Neuromuscular Lab is to get an amputee to play the piano with their prosthetic hand. The way that we do that is by creating a nerve-machine interface. What I mean by that is that the patient's own nerves will control a prosthetic hand. So they'll be able to move the prosthetic hand naturally like a human hand. They'll also be able to feel the prosthetic hand like a normal hand, where they can feel touch, temperature, pain, which isn't possible right now in any prosthetic limb.
We're the engineering team, so it's our job to take these beautiful signals that Dr. Sederna is creating by attaching muscle to the ends of nerves, and then we apply machine learning algorithms to those nice, pretty, nice big signals and use that to control prosthetic hands. The goal of this project is to take people who have lost their hand and enable them to control a prosthetic hand at the level of individual fingers, just by thinking about it.
When I was a kid, one of my favorite shows was The $6 Million Man. An astronaut, Steve Austin, crashed his test plane into the ground, lost an arm, an eye, and both his legs. And they rebuilt him. They rebuilt him better than he was before. Stronger, faster. We're working on it every single day to achieve those goals, to give people that hand back that they lost in the form of a prosthetic, but give it back to them so that they have the function that they had before. One of the aspects of my job that's been incredibly satisfying is my opportunity to care for some of the athletes at the University of Michigan. I've had an opportunity to help patients, athletes, student athletes from a number of different sports who've been injured on the field of play and have been injured participating in activities of daily living, the kinds of things that you and I get injured doing. And I've had the opportunity to provide for them my expertise to help them return to life, normal life, but then also return to performance, to perform at the level of an elite athlete, the type of Division I scholarship athlete that they are. Sometimes the injuries they sustain are so severe that they involve lots of different organ systems. Sometimes they involve bones, muscles, ligaments, nerves. Most of that can be effectively treated by the orthopedic surgeon, sometimes all of it. But at times, our expertise is needed to come in to work with a team to help provide that optimal functional recovery that they need to be able to return to the field of play.
As a team physician, it's great to have a host of critical and experienced providers that have focuses of expertise, and certainly a plastic surgeon is one of the critical pillars of that as you care for athletes of various levels across the country, and certainly here at Michigan. In many ways, we've taken that approach up front because we recognize that injuries to athletes don't just involve the single organ system in which we have expertise. You know, as a team physician in sports medicine, we focus on the structures and tissues that we treat most commonly, which are bones and ligaments, but also recognize that the injury involves it all, and oftentimes severe injuries can involve nerves and muscles and soft tissues and skin. And having a plastic surgeon who's an available and reliable consultant with expertise in treating those not only every day for all of us, but also for our athletes, becomes an invaluable resource when you need them.
There are amazing opportunities for us, and I'm so excited every single day to be able to have this job. It really is an honor and a privilege to be able to serve our communities in this way, to serve our patients in this way, and actually to help our specialty move forward.